Hello and welcome back to your therapy guide, the podcast created to help you navigate your therapy journey. I'm Dr. Yadegarfard, and in this episode, I'll do my best to answer one of the most common questions I hear. How many sessions will I need? It's a question without a simple answer. But by the end of this episode, I hope you'll have a much clearer understanding of what to expect. Let's be honest, if you ever asked this question, you probably heard the frustrating answer. It depends. I want to explain why that's the only honest answer and why it's actually a good thing. The number of sessions you need is not a fixed number like a prescription for medication. It's a highly personal and collaborative process. Think of it like this. If you go to a personal trainer with the goal of being able to run a marathon, they can't tell you on day one how many sessions you'll need. It depends on your current fitness level, how consistently you train, and what obstacles you encounter. Therapy is very similar. The length of time is determined by your needs, not by an arbitrary number. So what are the key factors that determine how long your therapy journey might be? First, your goals and the problem you're addressing. Are you coming in to manage a specific recent issue, like a stress at work or a single traumatic event? Or are you looking to explore long-standing patterns of behavior, deeply ingrained beliefs, or multiple complex issues? Short-term goal-focused therapies for a specific issue might last for 6 to 12 sessions. For more complex long-term work, it could be a year or more. There is no one-size-fits-all approach. Second, your engagement and homework. Therapy isn't just the 50 minutes you spend with me. It's the work you do in between sessions. The insights we uncover and the tools we practice are most effective when you actively apply them to your daily life. Your willingness to engage with homework, whether it is journaling, practicing a new skill, or simply observing your thoughts, will significantly impact the pace of your progress. We'll talk more about the importance of homework in a future episode. Finally, your therapeutic fit. The relationship we build is crucial. We will consistently check in with each other to make sure you feel heard and that the approach is working for you. To make it a little less daunting, I like to think of therapy in 3 general phases. Phase 1, the foundation. The first few sessions are about building trust and understanding. We get to know each other, clarify your goals, and begin to understand the landscape of what's troubling you. Phase 2, the core work. This is where most of change happens. We'll be actively working on the goals we set, challenging old patterns, and building new skills. You will start to notice shifts in your thoughts, feelings, and behaviors. The number of sessions in this phase is the most variable. Phase 3, consolidation and ending. As you feel better and start to reach your goals, we'll begin to spread out our sessions, maybe from weekly to every 2 weeks and then to monthly. This phase is about consolidating your progress and preparing you to manage challenges on your own. Ending therapy is a positive sign of your growth and resilience. So the key takeaway is this. Instead of asking how many sessions will it take, try asking what will be my measure of progress. During our initial sessions, we talk about this together. We define what success looks like for you so you can feel a sense of progress every step of the way. Thank you for joining me on this episode of your therapy guide. These short episodes are designed to answer some of the most common questions my clients ask, and I encourage you to listen to other episodes to find answers to your questions. Don't forget to subscribe to this podcast and follow me on my social media channels so you don't miss any future episode. You can find all the links in the show notes. Until next time, take care.